So, Dr. Gomez, I'll start with you. What percentage of Hispanic women are at risk for heart disease?
Well, recent studies have shown, Candace, that Hispanic women in general are at a higher risk. The prevalence of risk factors for heart disease is very high. Up to 70% of Hispanic women, for instance, can have at least one risk factor of heart disease, and 15% can have 3 or more, which makes this a very significant problem. Risk factors being recognized, of course, smoking, obesity, high blood pressure, diabetes, and high cholesterol. To add to this problem, Candace, we have the problem also that there's a lack of awareness that heart disease is the #1 cause of mortality, particularly amongst Hispanic women. So we have a bad combination of problems here, where you have a higher prevalence of risk factors and an unawareness that this is a very serious problem, the #1 cause of mortality. Therefore, that's why we have this campaign through womenheart.org, or Womenheart is the organization, but womenheart.org is their website, where we're trying to educate and raise awareness that this is a very serious problem. And women in general, but Hispanic women in particular, need to be aware of this, which is why Women Heart has created all these educational materials in Spanish also. And they're available via the internet, womenheart.org. And they can, Hispanic women can educate themselves about the risk factors, about going to the doctor, about quitting cigarette smoking, losing weight if you're overweight. All these important questions are answered in this website, and I strongly encourage everybody to check it out, women in general, but particularly for this occasion, Hispanic women.
Are there any other risk factors for Hispanic women? Why are they so at risk than any other group of women?
Well, the risk factors, the 5 risk factors are the same for everyone. What happens is that some segments of the Hispanic population do have a genetic predisposition for some of them. There are some segments of the population that are high at risk just genetically for instance, high blood pressure or obesity. So yeah, there's a genetic predisposition in some segments of the population, but to that we have to add the social factors. Now, our Hispanic diet is quite delicious, but it's very rich in complex carbohydrates and salt, which makes the risk factors worse. On top of that, Hispanic populations that move to the U.S. have even higher risk factors because to that we need to add then the fast food diets that are so common in our country here in the U.S. And on top of that, we have to add the increased level of stress, or always working against the clock. And that, of course, increases the risk factors and the mortality for heart disease. But again, the most important thing is to be aware that this is a very serious problem. Heart disease in women is very important, does not really respect gender or age. Yaskary Reyes here, the patient, is a prime example of that. At a very young age, she already had open heart surgery with 5 bypasses. Yaskary, why don't you tell us about your experience?
Yes, as a Hispanic woman living with heart disease, as doctor said, I have cardiovascular disease, and exactly 3 years ago, I underwent quintuple open heart surgery. And after my surgery, I was fortunate to connect to the organization Women Heart. And now, Women Heart has joined Burlington Coke Factory to launch this important campaign for the Hispanic women, which is called Para la Mujer Hispana. This campaign educates the Spanish women in their own language, in Spanish. And I motivate them to go to the website, womenheart.org. And I also motivate people to visit the Burlington Coke Factory stores and make donations to further improve and continue this important campaign Para la Mujer Hispana.
Yaskary, what do you recommend that Hispanic women do to prevent heart disease?
The first thing, really basic, is being aware. Being aware that this is the #1 killer in women. And now with these new studies that have come out, like Dr. Gomez has explained, we are at higher risk. So knowing that the existence of the disease is important. After we are educated and knowing this, then take action, visit our doctors, do the screening of the test, and then live a healthy lifestyle. Change the eating habits. Instead of having those delicious fried foods, just switch it for things that are more heart healthy. and incorporate daily walking into your life. You don't have to go specifically to a 4 or 5 days exercise program. Just take it one day at a time and do what you can the most on that day. Take extra steps when you go to the supermarket. Just park further away from the store so that you take that walking every day. Different things that you can do, but by going to the website, womenheart.org, you can find that information in Spanish and many, many, many more. So I motivate you to donate for this wonderful cause, which is very, very well worth it. And I'm thankful that I'm here being a spokesperson for Women Heart, bringing awareness to women in general and to the Hispanic women.
Well, thank you, Dr. Gomez. Thank you, Yaskary. I really appreciate it, and best of luck to you both.
Thank you very much.
Thank you, Candace. Thank you again.
Thank you. Bye-bye.